Well, parents are panicking in Samoa as the extent of the growing measles epidemic becomes clearer. It's believed there have been 8 suspected measles deaths among more than 700 cases.
All but one of them young children. The health system's cracking under the strain, and experts say this is just the tip of the iceberg. Our Pacific correspondent Barbara Drever is outside Apia's hospital and joins us now. Barb.
Yes, well, the public's been warned to stay well away from this hospital unless it's an emergency. Tonight, 8 children are battling for their lives in intensive care. All the isolation wards are filled. This is believed to be Samoa's biggest health crisis in living memory.
Prayer and family support are the only things giving grieving mum for Otuevale any comfort as she mourns the loss of her 2 children. Her infants are jointly buried in this grave after dying from suspected measles last week.
We depend on God to give us comfort and strength, and we miss them so much. But our faith in God will guide us through this.
Her 2-year-old surviving twin is gravely ill, also from measles, but the family have taken her out of hospital as they've lost faith with the health system. They're hoping traditional medicine will cure her and the disease won't spread to the others here.
We are concerned, as you can see. We have 3 kids, 3 sick kids, and we are fasting because we believe that God will get us through this.
As the death toll grows, panicked parents are racing to get their children vaccinated. One clinic alone gave 1,000 injections in just one day. This is the queue half an hour before the clinic even opened.
Parents are frantic to get their kids immunised, and the queues to do so are huge. Only children under the age of 10 are receiving the vaccine at centres like this around the country.
Immunisation rates here have been at a low 41%. It's taken this crisis to change that.
I think we have been very complacent, especially the population at large. And it's also our fault for failing to convince them to do immunisation.
Medical authorities here are working around the clock, looking after the sick and trying to protect the vulnerable. New Zealand's been asked for more vaccines and people power to relieve stretched staff here. Such is the level of need, Australia is building a makeshift intensive care unit, which should be up and running by the weekend.
Our new isolation wards, I think they are full. We are buying new beds, and we are also trying to renovate another building. I mean, not really renovate, clear and clean for further cases if it continues to be worse.
There are fears that's exactly what's on the cards.
I think it's sort of unfortunately unravelling as we would expect. This is like throwing a match on dry tinder. It's going off very, very fast.
For frightened parents, it's about protecting their children. For other families, it's just too late.
Let's go back to Barbara now. Let's talk about the response. What preventative measures are being taken, Barb?
Well, Cabinet's held an emergency meeting, and it's actually about to issue a directive that no child can start its primary school education next year without being fully immunised. Primary schools, of course, they shut their doors this week to stop the spread of measles, and as soon as they finish their exams, high schools will too. Now, the parents whose children have contracted measles, and there are many of them growing by the day, they're so worried, they're fearful, they want their children well, and some have in fact withdrawn their children from isolation here at the hospital to seek alternative treatment, and that's worrying some medical authorities. I'll have more on this developing story tomorrow on Breakfast 1 News Now, and of course tonight here on 1 News.
Barbara Drever and Apia, thank you.